गुड आफ्टरनून एवरीवन। टुडे वी आर गोइंग टू डू टोटल लेप्रोस्कोपिक हिस्टेक्टमी। और अगर मैं हिंदी में बोलूं तो हम बच्चेदानी निकालने का दूरबीन से ऑपरेशन कर रहे हैं। एंड द पेशेंट इज़ अराउंड 48 ईयर ओल्ड, केस ऑफ एबनॉर्मल यूटाइन ब्लीडिंग विद एडिनोमाइसिस. You can see there is a large symmetric uterus, and after that she was on Mirena, but that is the failed medical management. So we are starting. So first I am taking the left adnexal structures. You can see I already taken the left fallopian tube. Right now I am taking the round ligament, and my plan is to do surgery without any blood loss. I am trying to preserve all the blood vessels, and I will try my best to do the surgery without a single drop of blood loss. So I will go very slow. So I am very careful. As you know, there is a blood vessel at just below the round ligaments. So first I am doing coagulations properly, then only I will cut. And the instrument which I am using, that is bipolar shearer. That is very basic instrument, and I am a big fan of this instrument. I am doing all the surgery by this instrument only, and it's doing a great coagulation, you can see. And round ligament went. Now this is the left ovary, and now I am taking the ovarian ligaments. So first I will coagulate, and then I will cut, and I am going very slow, and I am taking all the precautions so that there will be no blood loss at all. And you can see still the area of the surgery is totally dry, and now all the adnexal structures on the left side is bent. And in this surgery right now I am only operating. There is no assistant at all except the cameraman, and the camera is shown by Miss Jyoti. She is my assistant in this case. And you can see now all the adnexal structure vents. So I will just coagulate here, and now this side done. Now I will come to the another side. This is the right side of the patient, and you can see clearly there is the uterus, that is, as compared to the normal, it's bigger. Now you can see I am taking first the right fallopian tube. Before cutting, you can see I am doing very good coagulation on the both the sides, lateral side as well as on medial side. And now I am cutting so that there is no possibility at all of any blood loss. So you can see now the fallopian tube is separated, and for just a precautionary measure I did the little bit more coagulations. Now you can see I am taking the ovarian ligaments, and the right structure is the ovary, you can appreciate. And I am now ovarian ligament is coagulated and cut. This surgery right now I am doing without any assistant. That's why no other person is able to give the tractions. If I have assistant, then he can give the traction from another side. Then surgery will be in more easy way. Minor oozing is there. So as I already told that I am trying to do surgery without any drop of blood loss. Now this part is done. Now coming to the round ligament, and first I will coagulate properly, then only I will cut. This is the round ligament. Okay, first I will coagulate very good in both the way, in lateral as well as on medial side. And you can see there is good coagulations. Still I am not happy, so I will do little bit more coagulation. And now it's coagulated well. still I don't want to take any chance because I am not in hurry. The patient safety is more important. So you can see I am going very slow and I am not in hurry at all. So now you can see this part is fully coagulate, and now I am cutting this part. And once I will cut this structure, then the uterus will be free on the right sides. And you can see the ball is not prepared very well. However, I given the peg leg, but I tried my best, and in this case I also taken help of our gastroenterologist to prepare the ball, but it was not very well prepared. Now both the side done. Now I am coming to the bladder separations. So this patient have history of all the previous normal delivery, so you can see there is no scar or no cesarean scar. So I will go very slow and I will separate bladder very slowly, because you know in TLH the one most important precautions or that is the bladder injury. So I am going very slow and I will separate the bladder from the cervix and the vagina. You can see on little bit part is left, and on left side all the dissection is already done. So just I will join both the parts, and these are few fibers that are left, and once I will reach in the right dissection plane, then bladder will go spontaneously. It will just slide. You will be able to see after few seconds. Now few more fibers, and till now there is not a single drop of bloodless is there. You can see. Now I will separate few more fibers on left side, and I am very careful at this side because just below of this uterine artery is there. So right now I don't want to dissect this artery, and now it's a very good dissection. Little bit I will push more. Now you can appreciate the manipulator is seeing and how good is bladder separated. You can see, and this is the right plane. You can see now. See how smoothly the bladder is went, and you can see the manipulator. Few more fibers that are left behind. Now I will dissect this part, then this side will be also free. And you know the most common site of bladder injury is the lateral sides, so I don't want to take any risk. And now you can see this part is also went, and now I am coagulating the sides. And meanwhile, once I will coagulate from here, then uterine artery will also be coagulated. I will not cut, but I will just coagulate here, and you can see this is the part, and I am just coagulating this part. And the most important that I am just doing just above the manipulator. Okay, so there is no chance of any ureter injury. Okay, and I will not cut. I am just coagulating. After that, once I will do from both the sides, then only I will cut. Why to take risk? And you can see the time till now is only 9 minutes, and on left side now you can appreciate. I am 100% sure that uterine is coagulated, but still there should be no chance of any bleeding. Now this side is done. Little bit smoke is there, so camera is cleaned. Now I am coming on the right side. On right side you can see there is dissection is already done. So now I will take the uterine. I will just coagulate. I will not cut, and I will not go more lateral, so there is no chance of ureter injury. So both the side the coagulate, and once I will coagulate, then you will be able to appreciate the change in the color of the uterus. And you can see the uterus is very bulky. That I told in the starting that this is a case of 48-year-old lady with adenomyosis and failed medical management. Now both the side the uterine artery is done. Now coming to cut. I am using the monopolar hook now, and I am just cutting just above the manipulator, and now you can able to see the manipulator. And how good dissection is this, you can see. And once I know, whenever you are seeing this video, most probably you are thinking that how easy it is, but whenever you will do, then you will come to know that it's not easy. And this part, when I coagulate, I told in left side, now you can see there will be no blood loss at all, because it's coagulated very well. And if there is good coagulation of uterine artery, then there will be no blood loss. And if blood loss is there, then we can hold that uterine artery and we can coagulate easily, because our visibility is very good. So I am going very slow, and you can see everything is went. There is no bleeding at all. Now coming to the uterosacral part, and that I will take slowly. Now you can appreciate right side uterosacral, how good it's looking, and it's very clear. Okay, and I'm going very slow because gas leaking is there, so space is very narrow. Now I'll come on right side, and now you will be able to see more clearly. I will go very slow because on right side, just I am thinking that might little bleeding will be there, because on that side the uterine artery coagulation, it was not too good, but still I am hopeful that there will be no bleeding at all. Still I will first coagulate, then only I will cut. Now you can see there is only minor part is left, and that will be done. So first I will coagulate, then only I will cut. You can see just first I am coagulating. If even there is 1% possibility of not coagulation of uterine artery, then it will be coagulated now. So first I am coagulating, then I will cut. Just I am going very slow. You can see this is the minor bleeding is there, so that I will control by monopolar hook only. No bipolar or nothing else is required. And this is the last part, and till time the time taken is only 13 minutes, and in 13 minutes the hysterectomy is completed. You can see the time. This is unedited video, and in 13 minutes hysterectomy is completed. Now we will remove the ovary and fallopian tube of both of the sides. So first I am taking on the right side. You can see both the fallopian tube and ovary I already held, and I will give the medial side tractions, so that there is no chance of any injury on major blood vessels on lateral pelvic wall. And the most important thing here, that you have to coagulate on lateral side in a very good manner, because once bladder will be there, then it's very difficult to hold that bladder. So coagulate laterally and cut medially. That is my basic thing that I am following every time. And you can see first I am doing very good coagulation, then only I am cutting. So you can see this is the vent. Okay, so right side salpingophractomy done. This I will put in manipulator. So I will remove everything from one way, and the manipulator I will put inside this manipulator, and this is the vent. Okay, I put inside. Now I'm coming on the left side. So now you can see that bowl is not at all very good prepared, but somehow we are managing. So now this is fallopian tube I am holding, and I will hold the ovary. This is the ovary, you can see, and fallopian tube I am holding both the sides, and I will give the medial side traction, and then I will cut. You can see, I am very far from lateral pelvic wall, so I will coagulate laterally and will cut medially. you can see there is very good coagulation, there is no chance of any bleeding, and this part is also vent and no bleeder. I will put this thing inside the manipulator and I will remove all the things in one go. Now you can see this is the, I'll put inside, and this is the vent, and I think I did in the most simplest way of the doing the TLH. So uterus is removed. Now I am taking the suture from the vagina only. You can see this is a suture came inside the cavity, and the suture is the Vicryl 10. That is the normal Vicryl. I am not using any Statafix or anything else because that are the costly suture and it's not available with us right now. You can see this is the vault. You can see very clearly, and gauge piece inside the vagina you can also see. So we will put 3 or 4 sutures as per requirement, and after that surgery will come to the end. So first I am taking the upper part of the vault. Now I will take the posterior part. So this is the vagina, yes, and this suture I am taking very good tissue in suture, and you can see inside the vagina vault it's looking very clear, it's dry, and I'll put 2 nodes here. So first is done, and I'll put 1 more node. So this is the second node, and the second nodes that is done. Now I'll take 2 more bites, and in 2 bites it will be closed very soon. Taken the upper parts, that is the anterior part, and now I'm taking the second part. It might possible that you are thinking that I am doing suture in the opposite direction. Many surgeons, they are first taking the posterior and then they are coming to anterior. I am doing in this way because I am feeling more comfortable in this way. That's why I am doing everything in opposite direction. You can see I am holding the needle in wrong directions. I cannot say that is wrong direction, but I am holding the needle in different, that is the opposite as compared to the normal suture. I am feeling comfortable in this way, that's why I am doing in this way. Otherwise you can do in the reverse way also, that is also fine. So this is taken, and I am involving the left uterosacral as well. So I taken in the both the sides, and once I will do, you can see the vault is already almost closed, and now I will take the note and the surgery will come to the end. The time taken is around 18 minutes, and it was for the demonstration purpose, that's why time taken was more. And in this surgery I followed all the standards steps that are written in the book, and I learned from my seniors. I am following the same way, and this is the last note. Now you can appreciate there is no bleeding at all right now. Still we will do the suction in end, and this is a suction. We will give the proper wash. We don't want to take any risk. So now you can see everything, there is no zing at all and fully dry. So we'll cut the knot. Thank you so much. We'll meet you soon.